Psychotherapist versus psychologist versus psychiatrist. What's the difference?
Okay, so psychotherapist, let me just start off with that, the title that I carry. So psychotherapist is someone like me who has a background in psychology, but may not necessarily have a master's degree in psychology or a PhD in psychology. Okay, because someone who has a master's and PhD in psychology are what we call the psychologist. And psychotherapists like myself, I do have a bachelor's degree in psychology, and I do have a training in psychotherapy skills, so the talk therapy modalities. So I can do counseling work and therapy work for clients who come towards me. For deep-seated issues is where psychotherapist comes in. Okay, whereas psychologists, as I mentioned earlier, they also have a background in psychology, but unlike therapists, they are with master's or PhD qualification, and they have the power to do diagnosis and assessment. They can also be under research, so they may not necessarily be in therapy skills training, but some psychologists do train in therapy work. So sometimes some psychologists also call themselves psychotherapists, but a psychotherapist can't call themselves a psychologist. So with psychotherapists and psychologists, the thing is we are under the social sector. Okay. Whereas a psychiatrist, he or she is from the medical sector. That means they are registered medical professionals, doctors who are trained in mental health in particular. So as psychiatrists, they will of course be dealing with not just diagnosis, assessments. Some psychiatrists do train in therapeutic methods as well. So they also sometimes call themselves therapists, but they are psychiatric doctors, and they can prescribe medication, psychiatric drugs in particular.